What are you having for breakfast?
O's.
O's.
Yeah.
What are you having, Laura?
O's.
I qualified as a nurse in 2002, worked on the wards for a good 10 years, and in the last 3 or 4 years I've been working as a clinical skills teacher in medical education. As a nurse, you tend to be on your feet quite a lot, moving around, and then as I moved into the job that I do now, which is less running around, I kind of felt that I was starting to gain weight, and before I knew it I think I was about 18 stone. At work, communications sent an email around about the workplace wellness programme. The timing really couldn't have been better for me. My wife and I had gone for a walk around Rother Valley and a car went past and there were some young lads in the car and they shouted, "Hey, fatty!" And I thought, who are they talking to? And there was only me there. And then the week later I got the email and I thought, right, now's the time.
Richard was one of 50 staff members at Sheffield Teaching Hospitals to take part in a workplace wellness feasibility study, something the Trust was keen to support.
Well, our previous medical director mentioned this to me, and we were trying to find the connection between staff health and well-being and reducing our sickness absence rates. Talked to Sheffield Hallam University about this programme and we decided to give it a go. We've done some research. It has worked with the staff concerned in the trial. Well, that's why we're extending it and rolling it out. And it has helped staff in those areas.
The programme was designed by a team at Sheffield Hallam University. Before trialling it at the Trust, they first tried it out on university staff.
So the wellness session itself is an hour long and usually conducted 6 to 12 months apart. The first part, 20 to 25 minutes of the session, is where we conduct the physiological tests. We know just obtaining measurements and feeding those back to people does not elicit behaviour change. So we use a technique called motivational interviewing to help people change their behaviours.
Certainly, telling people to change their behaviour and telling people you should do this and you should do that isn't effective. And to a certain extent, NASV is just giving them information. What we have to try and do is find out what's important for that individual and work with those values to try and find out how and when they're ready to change.
We've seen all sorts of success stories and radical transformations over the last few years, via people getting more physically active and perhaps losing a bit of weight. But we also see an improvement in people's psychological health as they are able to manage their low mood state via physical activity instead. And the impact that that has on quality of life is just remarkable and very positive.
As well as paying dividends to the individual on a personal level, the programme has also shown a return on investment for employers.
We have consistent evidence, both from the university sector and now from the NHS sector, that we have a £3 return for every pound invested just on absenteeism. In other words, people are more at work. We believe there's a much bigger return on presenteeism, which is the engagement of the staff when they're at work. We believe there's up to about a 7-to-1 return on presenteeism. So ultimately, over the whole programme, you could get something like a tenfold return.
Richard puts the success of the sessions down to the fact that they took place in work time.
When I've got this at work supporting me, my manager's supporting me and colleagues in doing this, then you can't really get away from it. When I went for my second session, which was 6 months afterwards, I was nearly 3 stone lighter. I'm a lot more attentive to my patients. I'm a lot more focused on my activity. My brain seems to be a lot sharper, and the day goes a lot quicker.
The Workplace Wellness Programme has been delivered in partnership with the Yorkshire and Humber Academic Health Science Network.
The Academic Health Science Network is all about spread and adoption of innovation. And Sheffield Hallam University had a fantastic workplace wellness programme. When we discovered that, we were really keen to know, can that actually be transferred into the NHS? And what difference would it make for our staff and our patients? That if we could only reduce absenteeism by 1/3, then the NHS would actually regain up to 15,000 extra members of staff, or the equivalent of, and would save about £555 million a year. So given the current state of the NHS, our need to do more for less, actually looking and targeting at staff health and wellbeing is an important priority for us.
We would like this programme to be rolled out across the country via our AHSN partner organisations, and also we'd like public sector and private sector take up. We're also doing a pilot initiative across Wakefield, which is groundbreaking in that this is a partnership initiative between health, local authority, fire and police.
The plan for the Workplace Wellness Programme within Wakefield District is really to take it across not only the Council and the CCG, but our Acute Trust, our Mental Health Trust, Wakefield District Housing, and a number of other partners that we're working with in the district. So it's seen as a holistic approach to improving the working lives of staff within the district, but also making us as organisations more efficient.
And the positive impact is something that Richard and his family have enjoyed since he completed his sessions.
What Richard's done has also influenced me by the way we do our food shopping now on a weekly basis. We shop a lot more healthily, and he now drags me out and does into his sport and his exercise and gets me out in the fresh air.
I think as a family we all win in this, don't we? I feel a lot better. We eat a lot better, don't we, as a family? Good example to Harry, and I feel a lot better at work.
I think we all experience a lot more pressure than we have in the past, and be it change or be it internal or external pressure. I think people are a lot more stressed, and ultimately I think this one way or another gives people, improved health allows you to kind of deal with that stress that much better. It tends to make you that much more resilient, or at least start to give you the tools, and it's that kind of toughness, both physically and mentally, that help people, cope with everyday life.
But I think the research shows that it is a win-win here. Better quality of care for patients, better staff motivation, and more efficiency savings.
Collectively, as a nation, we stand to gain a lot if people are healthier and happier. They're more productive and able to give back more to the country's economy, society, communities, and their families.